Mr. Mayor, council members, thank you all for having me. My name is Chris Lombardozzi. I am the Chief Medical Officer for Spartanburg Regional Healthcare System, and I've been asked to speak a little bit about masks and COVID. I'm happy to take any questions, try to clarify any facts that may or may not be out there while I'm here, so please feel free to stop me if I say something that doesn't make sense. But basically, we're at a stage now where we are a hotspot. The Greenville, Spartanburg area, the Columbia area, the Charleston area, really any area in South Carolina where there's a large density of people, we're now seeing an increased number of cases. Our cases inside the hospital have increased back to where they were at the beginning of the pandemic. And clearly, as the reopening of businesses and other activities have occurred, people are getting closer together, and we're not adhering to some of the things that we know will decrease risk. There's nothing really special. There are no magic bullets, no cures, no true effective treatments yet. There will be, but they're not out there yet. And so as a community, not just locally, but regionally, state, nationally, some of the obligation we have is to protect ourselves, but also to protect each other. We know that things like masks, hand hygiene, staying 6 feet apart. I am very happy to see the way we've got this set up today, and I thank you for taking us out of the council chambers to be able to do this. But these are fairly simple measures that greatly reduce your risk of contracting the disease. I think there is a misconception out there about how serious this is. We've had over 100,000 deaths in the United States. We've had well over 600 in South Carolina. There will be more, and each of those is a tragedy. Most of the people who are dying remain fairly vulnerable people. They are older age. They tend to have more comorbidities, meaning they have things like diabetes or heart disease or lung disease. But it's not only those people. So we're trying to protect our parents and grandparents, but we're also trying to protect each other and our children. Is it rare that younger people contract the disease and get sick? Yes, it is rare. And so I can certainly understand if you're 25 years old and you're thinking to yourself, not a big deal, I'm going to be just fine. The reality is you're probably right. But if you contract this disease with even mild symptoms and you come home to your family and give it to your grandmother or grandfather or some other person who has other medical problems, then there's a fair chance that person could get very sick. And that's what we're trying to prevent. So I'm not here to tell people what to do. As a doctor, that's not my job. My job is to provide some reasonable evidence and some reasonable advice. I'm here to tell you that there's a lot about this that we still don't know, and we'll continue to learn as time goes by. But there are some things we do know, and some of the things that we know are that it is spread by coughing, sneezing, loud screaming, talking, anything that projects air from your mouth or nose. We know that it enters through the mucous membranes of your eyes, your nose, and your mouth. And we know that if you put on a mask, it does a couple of things. One, it prevents you from coughing and sneezing and having it go 6 feet out. It helps to prevent some incoming, but, and I'm sure you've all noticed this, if you're wearing a mask, what else does it do? It makes you really aware of touching your face. And so for many of us, your hands are where you touch things. Your hands are where you contract things. You get something on your hands, and what do? We all touch our face. If you wear glasses like I do, you're constantly wiggling with your glasses. You're rubbing your eyes, you're scratching your cheek. It's what we all do. Having a mask on sort of makes you more aware of that and makes it less likely that you're going to do it. So please do put the masks on. I'm asked fairly regularly, when should I wear a mask? And my answer has remained the same. If you are in a relatively dense public location, put the mask on. It's not that hard. It's not terribly onerous to do that. If you're at home with your family, then clearly you don't need to be wearing a mask. Those are the people you live with all the time. If they have it, you're probably going to get it. But there isn't much you can do about that. But if you're in a place of work, if you're in business, once we open schools, we can do this well. We can do this safely. We can maintain, I'm not going to call it normal, but we can move forward. And I think it's really important to do that. We can move forward with semi-normal activities. We can move forward with education. We can move forward with business. But we've got to be smart about it. We just have to use some common sense. And if we do that, we're going to be just fine. Will there continue to be cases? Absolutely. Will there continue to be sporadic outbreaks regardless of what we do? Yes. Can we manage that as a healthcare system and as a community? Yes, we can. With that, I'll ask for any comments or questions that you may have.
Any questions?
Yes, sir.
Mr. Mayor. Dr. Lombardozzi, thanks for being here and for spending time with us. Wanted to ask if you could give us any statistics on where we are in terms of patients in the hospital, bed utilization, what kind of capacity we have in the Spartanburg healthcare system.
Mm-hmm. So fortunately, and I've said this before, the nature of our healthcare system, by having 5 hospitals, 1 in Union, 1 in Cherokee, Mary Black, Church Street, and Pelham, is that we have a little bit more flexibility than some healthcare systems might have if they only have 1 hospital. So we are able to move patients around based on their needs and based on the resources that we have. And so we've been able to maximize what we do. And to back up a little bit, most of our COVID positive patients are on the Church Street campus. We keep them there. They're in special units, and we try to keep what we call sort of a hot unit and a cold unit. And so the folks who are coming in for general medical care, and I should say, we've continued to take care of all the other stuff. So while people are having heart attacks and car accidents and breaking your wrist when you fall down and getting pneumonia, we continue to do that. But we've been fortunate to be able to spread those people around at the different hospitals based on our need. In terms of bed capacity, we're in good shape. We've been somewhere around 80% or so, with ups and downs, but in that range for really the last 4 to 6 weeks. So we're good. In terms of patients who are in the hospital, we've got about 30 or so that are what we call COVID positive. Those are patients who've been tested and have turned up positive. That number has gone up, and I think it's important to say that. At the low point before Memorial Day, we were at about 15 or so, and we've been in that 25 to 30 range for the last several weeks. So, we've had significant increases in the total number of patients who are in the hospital.
Thank you.
Any other questions?
Mr. Mayor, if I may, Doctor, thank you for being with us again. I'm sure you saw Molly Spearman, you mentioned schools. I'm sure you saw what she said last week, which I'll quote it for everyone. If you want to go back to school, if you want to go to football games, if you want to cheer on your team, you need to be wearing your mask when you're out in public. I am sure that I am not the only parent that wants their kids to go back to school. And I know you've been meeting with our superintendents as they are trying to decide what's next for us. And I'm not asking you to predict the future, but if we do not grab a hold of this soon, what do you anticipate happening with both your capacity as a hospital, with our school systems, with being able to cheer on your team, going to football games, all these things that we consider a part of normal life?
Yeah, it's a great question. Let me start by saying that the school superintendents, the folks who are involved in the leadership of the schools, they have potentially a much more difficult task than we even have in the healthcare system. When you're dealing with kids from knee high up to high school seniors, And I'm not even talking about the colleges, which is a whole different ballgame, and the logistics of trying to educate children effectively while we're going through all of this. It is incredibly complicated. And for those of you who don't participate in those kind of meetings, let me just tell you, those folks are working day and night trying to figure out how to manage this to get our kids back in schools. So I appreciate what they're doing. I appreciate the question. There are going to be outbreaks no matter what we do. You'll have a kindergarten where all of a sudden 5 or 6 kids or their teachers, which is also probably more likely than the kids, getting sick. You will have a business that 3 or 4 of their employees all of a sudden get sick at the same time. You will have a high school basketball team, as an example, where 2 or 3 of the star players all of a sudden get it. We're seeing this with the professional sports teams that are trying to come back now, and they're doing preliminary testing and finding out that there are significant numbers of these professional players who are testing positive, and they haven't even started the training or the seasons that they're intending to do. I think the key this year, and I say this year because it is not going to be a couple of months, it's not going to be December, it's going to be about a year or so to manage this. I think the key is going to be flexibility, it's going to be adaptability, and it's going to be creating expectations that we can manage. I don't know what a high school basketball season is going to look like this year. I really don't. It may be that a team is perfectly fine and next week a couple of kids get sick, or the opposing team has some players that test positive, and you can't play the game. And I think as parents, and I am a parent, I have 2 daughters, one in college and one at Dorman, I think that we have to set expectations of we're going to do the best we can this year. Let's enjoy the sport. Let's enjoy the camaraderie. Let's enjoy the learning. But perhaps this is not the year for a lot of serious competition in changing that expectation. And that's a personal opinion. That is not the opinion of our healthcare system. But I think as a parent, to answer that question, we need to perhaps lower our expectations of what can be accomplished and take what we can get, because it's going to be a tough year.
Thank you, sir.
Doctor,
Yes, sir.
thanks again for the update. I know the hospital system has been working in concert with the chamber on some education programs and trying to encourage proper protocols and responsible use. As you and your team are out in the community, do you get the sense that our business community is responding appropriately in instilling in their staff and in their customer base the proper protocols?
So I think that we can do a better job. That's probably the nicest way I can say it. These are not, it's not fancy, right? Putting a mask on and washing your hands is not what we'd all want. We want to wave a magic wand and it all goes away and we can go back to doing all the things we want to do. And we will likely be able to do that, but not right now, not for the next couple of months or even for a year. Until we have the ability to see what happens when someone gets sick and then gets reintroduced to a community where there's an infection around, right? Do you have immunity or not? We don't know the answer to that. If you develop antibodies, I'm sure you've heard about antibody testing. If you develop antibodies, which generally happens when you've been exposed to a virus, you get the virus and then you develop some antibodies. What we don't know yet is, does that confer any immunity and for how long? We just don't know. And we won't know for at least a year. You got to have enough people who get sick, then enough people who get exposed, then enough people who you kind of see what happens. And we just don't know. And so I know it's, this is not what you want to see when you go into a business, right? Hey, how are you doing? One keep everybody 6 feet apart. Okay, hang on, we only need 5 people in the room. That's the maximum. It's not what we want to do. I get it. It's not fun, but it's the right thing to do right now. And I think as we get used to that, as we promote that as being the right thing to do, we will have safe businesses, and eventually safe businesses become successful businesses. And I think that's a key point. If I'm a potential customer, I want to go to a business that's promoting safe practices. You may as well. And you may choose not to if you think that that business is not promoting safe practices. So I know that that's logistically very, very difficult, depending on the type of business that you're trying to run, a large business, small business. It may be very, very difficult. And by the way, if you need help, please reach out to me personally or to our healthcare system. We're more than happy to work with any businesses and see what we can do to help you out. That's what we're here for. We are partners. I'm a member of this community. I've been here for 16 years. I'm as invested as anybody else in the health of this community. So please do reach out to us. We're happy to help.
Any other questions?
Mr. Mayor, I do. For the doctor, thank you for coming and giving us this information. And I have to go back to the younger people. I do have 2 teenage boys at home that are participating in sports, and
Yeah.
we're trying to social distance and all that, as well as being a coach myself. And we're asking the questions, we're taking temperatures and all, but if a kid, and I guess the asymptomatic, I mean, help me understand if,
Yep.
we have a kid that's walking around with it, not showing any.
So both in Spartanburg and in South Carolina and throughout the country now, there's been enough asymptomatic testing, and that's testing of people who don't feel sick, right? You're not running a fever, you're not feeling sick, but for some reason you got a test. That number has hovered less than 1% positive for a while, and depending on the community and the particular group of folks that they've tested, it can be as low as less than 0.5%. So 1 out of 200, 1 out of 100 people that get tested who do not have symptoms may test positive. What we don't fully understand, and then let me say this again, what we do not fully understand is how many of these folks who do not have symptoms are actually spreading virus. And the hard part about that is if you have a cold, right? We all catch a cold, we all get the flu. A day or two before you get it, maybe you just feel a little achy, maybe you'll have a little scratchy throat, but you're not actively coughing or sneezing. You're probably not spreading the flu virus a lot. You might be spreading it a little, but not a lot. A couple days later, you start to get sick, and now you're coughing and sneezing, and now you're spreading it, right? We all get that. But in those couple of days before you start to develop symptoms, you just don't know, and that's part of the problem. Any one of us could have it right now, but we just don't know. But we also don't know how infectious you are. So the person who doesn't have symptoms, are they terribly infectious? Probably not. Probably not. Their risk is really low of spreading it. But it's not zero. And that's the problem. It would be great if I could tell you that the risk is zero, but it isn't. It's not zero. And so we're all trying to manage, and this is the hard part for a school, for a coach, for a business. At the end of the day, we're all trying to manage risk. We get on the highway and we start driving, we're taking a risk, right? But we all wear our seatbelts. Hopefully we don't speed. We're not drinking and driving, right? We're lowering our risk when we do all those things, but we still have risk. We assume risk every time we get behind the wheel of a car, but we all do it, right? So there's a way to do this to manage the risk, and I think that's what's really important, and that's the key here. Wear the masks, good hand hygiene, do the 6 feet when you can. When you can't, make sure absolutely that you got the masks on. You practice those things, we're going to reduce risk. If we reduce risk, we reduce spread. If we reduce spread, we're going to be a healthier community. If we're a healthier community, more of the kids go to school, play basketball, play football, and do all the other things we want to do. So thank you.
Mr. Mayor, I have another question. We've spent a lot of time, both as council and larger national conversation about the economic health of our country, of our community, since businesses have had to close and people aren't out and about as much. And, we've talked about restaurants and, small businesses, but I think your value in our community is not just as a medical care provider. You're one of the largest employers of our city and our entire county.
Right.
And when we talk about economic health, our economic health is directly tied to yours. And I know at the beginning, you all, as lots of hospitals across the country, stopped elective surgeries. Some physicians went on, were furloughed to make space for room. And I think we need to be having the conversation that if we want our economy to be back up and going where it is, we need you to be economically strong. And I'm not privy to your profit and loss sheets, but I can imagine, and please correct me if I'm wrong, that the longer we slow bleed this out, the longer you do as well, which affects good jobs with health care and with benefits and middle-class families who are depending on you, which is really important to our economic health. And I think we need to be having that conversation, and I welcome you to share that right now with us.
I can answer part of that, and I would encourage you to go to the board meetings at the healthcare organization when we have those. Those are open public forums, just like this. So there's nothing to hide. And we are a public entity, so we work for you. That said, we are in, I would say, fairly stable and probably a better economic position than many of the healthcare systems that I'm aware of throughout the country. We did have to furlough quite a few people. Those furloughs, for the most part, ended a few weeks ago, and virtually everyone is back to work, so we're happy about that. We were also able, and I think this speaks to the financial position of the organization, that we were in a position to furlough people, but people were still getting paid to be at home. So we were able to support those folks, not fully, for sure, but able to support them in a way that was not the worst possible financial hardship. Certainly not ideal, but we did the best we could, and we've been able to get them back to work quickly. In terms of surgeries, we are back to essentially normal in terms of elective surgeries, and so we're in I think we're in a good position. I'm very proud of our organization. We've managed through some very difficult times over the years. We do try to think about those things very much, and we're very aware of our role as a central employer for Spartanburg.
We want to thank you, sir, for coming and sharing this
My pleasure.
information with us.
Anytime. Thank you.